Hello everyone, I'm Dr. Siddhartha. I'm the Orthopedic Surgeon at Citi Neuro Centre, Tirumalgiri. I specialize in joint replacements and trauma surgery. So today we are talking about fractures. So what is a fracture? How do we identify them and how we treat them? A fracture is a break in the continuity of a bone. A fracture commonly happens following an injury in a road traffic accident or by a fall. Sometimes it can also happen by a minor fall in very weak bones like in osteoporosis or in bone cancers. So how to identify a fracture? There is abnormally high pain following a fracture. A person usually wouldn't be able to walk if the fracture is in the lower half of the body. There's a lot of swelling, bruising, and discoloration or even deformity of the limb in a fracture. So we normally diagnose a fracture by X-rays. Sometimes we advise MRI and CT. And coming to the treatment of a fracture heals naturally. It is very similar to how a skin heals following a cut by scarring. So our job is to reduce the fracture back in place and hold it as it heals naturally. So we treat most minor fractures by immobilizing them in a plaster cast. If the fracture is severe, if there's a lot of gap in the fracture between the different fracture fragments, we need to operate. So during surgery, we put the bone fragments back in place and immobilize it by using metal implants like plates, screws, metal rods. Following a fracture, we advise rehabilitation by physiotherapy. It usually takes about 1 month to 3 months for the person to get back to his normal activities.